Excuse me. So we are starting the demonstration.
We look at the wound base and we're happy, only to realize later that the wound oozes pus. It's because it could be having a sinus tract. So the best thing is to try to press a bit and know whether it's also feeling pain. Then the pain will tell you there could be infection deeper in the tissues. Two, when you're pressing a bit, if you realize there is a pus draining, like you can see pus draining from this side, so that tells us that there could be a problem inside there.
You've got to look at footwear. It's very, very important. This is not a great shoe for a diabetic. Why? How old is this shoe? 2 years. Okay, you can see the seams are worn on it. Okay, it's not very clean inside. The seams are worn down, and what happens with diabetic patients is they can't feel if they're wearing the wrong shoe. So what happens is the seams start to destroy the tissue of the skin, and then that creates ulcers. So what you've got to be very careful of is also with open shoes, when they're wearing open shoes, if they're working in the chambers or something like that, something can prick them from the side and then it can create a wound as well. So make sure you discuss. Also, you shouldn't be able to collapse a shoe like this because it doesn't have enough support.
Thank you, Dr. Maina, who's demonstrating how comfortable the patient will be, and maybe in the future we can even offer them a cup. So the person will come and will be able to sit down here and actually assess the food. And when they need to clean, normally now we have a problem in the hospitals because normally we don't have proper basins. They will be able to dress and do everything at the same sitting in a small space. Here there is a food pedal, a big container where they will put in their rubbish, and this will ensure that there is good infection control in the diabetic food clinic. And we are happy that this will be available in all our provincial hospitals and with time also on the district hospitals as well.
I want to take this opportunity to thank the Kenya Diabetes Management and Information Center. I want also to thank the World Diabetes Foundation for providing the financial support to DMI. And I want to thank my colleagues in the Ministry of Public Health and the Ministry of Medical Services for coming together to start this program that's going to strengthen diabetes management in this country. So today it's my great pleasure to commission this equipment, which are actually a full clinic equipment for management, that is in terms of diagnosing and the treating of food complications of diabetes, to the team from the provinces, from various hospitals, from the provinces and district hospitals, whom we have been working together to support diabetes management in this country. So I take this opportunity on behalf of the team to hand over these kits to all these hospitals, and we will hand this one to Kakamega Provincial Hospital to represent all the other facilities in this country that are going to benefit from this equipment.
We are commissioning